Next, we have health details. Health details will give us a general overview, very beautifully, of all of the device responses. So we have the patient quick profile again with their MR number, date of birth, phone number, provider name, care manager, and care manager phone number. Then we have 3 different tabs here: health, the medications that they will be using, and any documentation that they have signed or need to be signed. Let's go back to health. So here we have a graphical representation of their blood sugar levels laid out very beautifully, okay, with an average displayed here. This is the blood sugar level, and this is the time right here. We can also click log to show a log of the responses here. We can see when the blood sugar was taken: lunchtime, and the result was 100, breakfast, and the result was 300, fasting, 100, lunchtime, 105. So really wonderfully laid out. If we scroll down, we can now see responses for how do you feel. Again, we can see this as a graphical representation, or we can see it as a log. In this example, it's based off a scale of 1 to 10. So on the 27th, they were feeling fantastic, but on the 24th, not so much, as you can see by the 1. So really wonderfully displayed. We'll go back to graph to see this in a graphical representation. And if you hover over and click, you can also see a little bit more details. You can see the response was a 9. You can see this was taken on the 23rd of March, 2023 on a Thursday. So very cool. And again, we can see the average of all of these responses. What a great, awesome way to kind of get a really quick, fast, and effective overview of responses. I really love this average feature. Next, we have hours of sleep, which again, we can see in a graphical representation or the log. We have their body temperature, their weight in pounds, blood pressure, heart rate, their water intake, their step count, and the number of floors that they have climbed. Pretty cool. Next, let's check out medications. Really awesome that we can add a medication here if we'd like on behalf of the patient. So say a doctor has prescribed a new medication for a patient based on a telemed, well then we would go ahead and we could add that medication here. And as you can see, we have medication name, the strength or unit, the form, the route, which is like how they would take it, either orally or injection or topical, or there's a few others. How many to take, and then how often. And then as well, when do they typically take it, in the morning, afternoon, or the night. Again, we can add additional notes here. We can add the prescribing doctor's name, and then the effective date, and then we would click add if we were adding that medication. In this case, we're not, so let's go ahead and just click the back arrow. So we can see a list now of all the medications that the patient has taken or is taking. We can edit those medications by clicking this edit button, or we can delete a medication by clicking on the trash can icon. Make sure that you only delete if advised by the practitioner of that patient. Again, a list laid out very beautifully here. Wonderful. And then the next tab will be the documents. These are the documents that have been signed by the patient. So it gives us the name of the document, the type of the document. This is the RPM consent agreement. The name, which is signed consent, and then the date at which it happened. So March 20th of 2023, and the time was 6:36 p.m. As you can see, we can delete this document if you would like, but I would advise that you make sure that you're correctly deleting any information, as we don't want to remove any information needlessly. This little arrow will let us collapse the view so that we can see this expanded or not. And then we can also click view to view the actual document here, which is very cool. We can also send this information to the patient if they'd like through the phone here by simply clicking this icon right here, and that'll give you a few options in which to choose how to send it to the patient if they'd like. Let's go ahead and simply click done. And that is a overview of health details of this patient.